So what I want to talk about today is using the full body approach and how we might look at neck pain. So if you're someone who has neck pain, probably there's a good chance you may be working in an office, you use your computer every day. Maybe you're not very good at using your phone in terms of head posture, which is usually going to be down like this. There's a number of reasons why someone would have neck pain. All right, but let's say you're someone who has neck pain, decide to go see the doctor refers you to physical therapy, you go see a physical therapist. Now, in physical therapy, commonly you're going to be looking at your neck, obviously, right? So that's through C7, seven cervical segments. They have a disc between each of those segments. There's a joint on each side, left and right side, on each of those segments too. So common things that we'll do in physical therapy is try to get the cervical spine to glide, move in different directions, rotate. We'll look at how your head motion is. Like, that gives us a lot of information. So oftentimes I'll often ask my patients to do something that can reproduce your pain. So if you have neck pain, there's a good chance either looking down or looking up will hurt. Or it'll be a rotation to the right, left side bend. All that information will give you information for us to be able to piece together that puzzle to figure out where that neck pain is coming from. But let's say you're one of those patients that has had physical therapy or even chiropractic medicine, and maybe you leave the office, you feel a little bit better, but that pain always returns. Or you go back to work, the pain returns again. Or you're sore and you're stiff, and every time you stretch you feel better, but it always comes back, and there's this recurring cycle that occurs over and over again. So how do we use the full body approach to be able to determine that patient if treatment is not really giving those long-term results? So some other hidden spots that I like to look at that people with neck pain will have is looking at how well do the ribs move. In PT school, we're very big on looking at how the first rib moves, but I'm going to say that the entire rib cage should have some motion in order for you to have proper cervical mechanics. So that includes 2 through at least 4. I'm going to look at 2 through 4 no matter what, and then I might look down below just in case if there's more issues if you're not making some improvements. But I'm definitely going to look at not just the first rib, but all the way down. And the first rib is all the way up to here. It's about the size of literally your hand making a little C, and then those ribs incrementally get bigger and bigger. But the mechanics of the ribs, to me, are part of the spine, and that spine can't move. I can't expect other parts of the spine to move too, right? So if your neck is not moving very well, or if you're in the cycle, the rib cage is an area that I like to look at. And so when you look at the rib cage, no matter what, I'm going to look at the ribs and its associated thoracic spine that is attached to, right? So that is the part of the spine below the cervical spine. And not only that, I'm going to look at how well those ribs, when they attach to the front, how well does that sternum move also, right? I don't look at the ribs as just left and right rib. I look at the ribs connected to the thoracic spine segment, connected to their sternum. And if you look at that whole complex, it essentially makes a ring. So I can't expect things to move very well if that whole ring can't move also, right? So if I turn my body to the right, I need T1, T2 to turn backwards. I need T1, T2 on the left to move forward. And if that the thoracic spine or parts of the sternum not letting it move, I can't expect my head to move along with that part of the spine. Another hidden spot, TMJ. If your history includes neck pain, but also headaches, tinnitus, which is the ringing of the ears, jaw pain, clicking, hurts when you eat, or if you laugh, or if you yawn, you clench your teeth at nighttime. They're all signs of things are not really working on very well here, right? And to me, TMJ is highly correlated with what's going on in C1 and C2. So the upper cervical is not moving very well. There's a good chance your jaw's not moving very well too, all right? And if no one's addressing C1, C2 very well, or not addressing the jaw, that jaw might funnel and be a source of dysfunction in your neck over and over again because no one's addressing this connection between the jaw and neck pain. So those are 2 spots above, one above the jaw and one below thoracic spine. Other areas that might be funneling into neck pain if you're caught in the cycle where you're having short-term relief, but then it keeps coming back. You go to the chiro or PT and it keeps coming back. You do your stretches, it keeps coming back. So if that's your situation, that you're thinking that maybe you're having recurring neck pain, not really getting long-lasting results, but then maybe this might be your issue, we need to do an evaluation to make sure that you fit within that model. So if you have any questions, please give us a call or take a look at us on our website, www.jlukept.com. Thanks.